Good afternoon, everyone, and welcome to today's webinar. As folks sort of trickle in, we're just going to give it a few moments and let the space fill and get everybody on board. While we do so, just want to remind you all about a couple upcoming events that are hosted by the Radar Center here at the University of Nebraska-Lincoln. Our next event will be October 9th, hosting Dr. Michael Webster. This is a free online webinar, much like today. You can check our website, radar.unl.edu. Having a little bit of technical difficulties right now, but we'll have a full list of all the events there once the website's back up. And then in November, join us for our free online symposium on substance use research. It's a 2-day free conference, all online. It's a collaboration across 5 different research centers in the United States. Come check it out. We've got some great keynotes this year and hopefully a lot of amazing talks. So it looks like we're getting a good number of folks in. And so let's get started. I'm absolutely delighted today to introduce Jonathan Stoltman. He is the director of the Opioid Policy Institute, which is a research think tank that uses multi-pronged approaches to better understand gaps in treatment and recovery services, and is the co-director of Reporting on Addiction, an effort to improve the accuracy and empathy of news coverage about addiction. And just like to thank you so much for joining us today. We're all super excited to hear your talk. It's much needed and really looking forward to what you have to say. Sorry, one last note, my apologies. We're largely saving space for Q&A at the end, but please use the Q&A function throughout. If you have a question, pop it up and we'll see if we can have time to sort of move it into the fold. Otherwise, we will address it all at the end. And thank you so much. And Jonathan, the floor is yours.
Awesome. Thank you, Patrick. Really happy to be here today and appreciate everyone taking the time to learn a little bit about this topic and hopefully figure out some ways to interact with the news media. I'm representing Reporting on Addiction today. That QR code is just going to take you to our website, which is just reportingonaddiction.org. And then for disclosures, I do not have any disclosures related to this work. We do have a small grant from Open Society Foundation that started in spring of this year, which we'll talk a little bit about the work related to that. It's specific for opioid settlement stuff, which is another area where it's really important to get experts involved with the news media. So some quick learning objectives today. Just hopefully we'll describe a little bit about how the media produces content and the shortcomings with the approaches related to reporting on addiction. And then, of course, better understanding how stigma, intersectionality, and discrimination can be reduced by working with the news media as experts, and then gain some practical tips for interviewing and hopefully be empowered by the end of the call to work with local, regional, and national publications to really spread your knowledge about this topic. I love this quote from Sharon Walsh at University of Kentucky, and it's one of our guiding principles really with reporting on addiction. Perhaps the greatest challenge to expanding access to evidence-based treatment is stigma and lack of public knowledge about treatment efficacy. So that really drives our work. And what we do is we try to help the general public understand these topics related to drug use and addiction. We also try to help them understand how their reporting can further stigma and discrimination that really hurts folks who use drugs or are in recovery, interested in accessing treatment, interested in expanding access to evidence-based prevention programs, all of those things that fall under that umbrella of addiction science. So we try to increase knowledge about addiction medicine by focusing primarily on journalists and journalism students. And the reason that we do that is we know that journalists really drive the culture. They're great at storytelling. They're great at empathy. They're great at those like narrative hooks to really pull readers in to understand topics. I don't know if you've experienced this in your career, but I frequently have friends and family that will send me a news article that'll be like, wow, did you know about this? Like, this was so crazy, or this was so moving. I cried by the end of it. And you can really see how like that hits so much differently than, say, one of our academic research articles. So working with journalists to make sure that they're not doing things that also cause harm in that reporting is a really important effort, we think. So our goal broadly, like Patrick said, is to create a more accurate and empathetic public discourse about drug use and addiction. And we do that through a few different specific things. We want to improve the language used by journalists, which also includes improving the language that we use as experts when talking to journalists. We'll talk about that here today. Improving the themes and story narratives chosen by journalists when they're approaching their reporting, and then improving the images and videos created by journalists, because each of those different aspects really impact how the general public understands this topic. So how we do that and our impact broadly since we launched in 2020 is we work across 3 main domains. So one of the things that I love doing as an expert in the area is working with other experts to help get you off the sidelines and get you working with your local news media to help shape some of this narrative coverage. So we do things like we're doing today, which is training. And we also do talks and conferences. We work with anywhere from trainees like T32s, PhD students, any of those folks, medical students, nursing students, any of those people, all the way up through professors to help them, really get comfortable with working with the news media. We also work with professional journalists. We've worked with over 100 at this point, and we do newsroom specific trainings. So if there's a newsroom, say in Omaha or Lincoln, maybe it's an NPR affiliate or a local publication that you're seeing some of their coverage and you feel like they could use some help and you're doing some interviews with them, but like you don't have a ton of time. When you tap us on the shoulder, we can come in, we can do whole newsroom trainings, or we can do more one-on-one technical assistance with those individuals as well. And then we love working with those educators and students and that next generation of journalism professors or journalism practitioners, because one of the most exciting things is working with those young students on campus that are really trying to understand these journalism principles, and the idea that they'll take this information and then they'll break that cycle going forward is really fun. That map is not up to date, unfortunately, but we are in 19 journalism schools throughout the country at this point. We would love to be at University of Nebraska for our next journalism cohort. We do train the trainer sessions over the summer. We also work with student-led newsrooms. So if any of you have contact or influence in those student newsrooms, we do trainings with those groups and present at national conferences as well. So by really hitting across this whole continuum, we have been seeing a lot of progress in the 5 years that we've been working on it. But of course, even though that map's not super up to date, we're not in every state at this point yet. We're in a lot of states, but we're not in every state, and there's more that we can always do. So appreciate your attention to this issue. Why do we need experts in the media? Well, one of the biggest things that we encourage folks to do is really embrace your expertise. I love this image, and if you are a young professional or a trainee, like this is just that type of thing that always goes through your head. All of a sudden, like you're just an expert. And I will tell you, this is something that like I continue to have a really hard time with when I talk with journalists. And they're like, yeah, I mean, you're clearly the expert on this. I'm like, well, I know some things about these things, but I wouldn't say, for example, I know everything about addiction. Like I am pretty good about harm reduction treatment, pretty okay-ish on recovery. I could learn a lot more about prevention, for example. So I try to draw those boundaries around myself. But at the end of the day, like a journalist is going to see you as an expert. You're a graduate student, you're a professor, you're whatever, like you're someone that knows about it. The other challenge with that is they also throw around that term expert a little bit more casually, like for a sheriff's department or sheriff official, or like someone from the mayor's department, which maybe doesn't have that same level of training. So what we want to help folks understand is they're going to see you. Journalists do want to inform their community and they want to make sure that they understand these topics. But oftentimes the hardest thing for them is to find sources. So we address this with our database. I know that there's some Nebraska folks on there. I think, Patrick, maybe you joined recently or somebody else might have joined from University of Nebraska. I encourage everybody to find that. It is on reportingaddiction.org, and it's in our expert resource tab. There's a public database that you can sign up for, and journalists use that to try to find sources. I also use that because journalists, even though we have the database, they'll still ask me, hey, do you know someone that can talk about this specific thing? And so if I have a database of folks, I can help throw you out there. But putting yourself out there is a really great way to, one, help people find you, and two, like let journalists know there are people that can talk about this in Nebraska. We want to recognize too that there are barriers to this. All of this like sounds really good, but we know that one, a lot of folks lack media training or the time to get media training because your jobs as an academic are really demanding. And the idea of like taking another thing on your plate when you're already maybe doing teaching, mentoring, research, other service stuff. Some people are clinical providers. Some folks are harm reduction workers. And we know that all of those areas in addiction medicine, especially now, are like stressed to the absolute minute. So we know that that's a real world barrier for you. But what I would encourage you to consider is that some of these things are the types of things, maybe you can do them in your car. You can do them for 15 minutes during lunch. It doesn't have to be this huge, big sit down where they bring a camera and it's an hour-long interview and you got to prep and do all this stuff. Some of it is just a journalist like, hey, I need a quick couple quotes on this topic. And once you start to build that rapport, you can help them see that there are, again, these people in the community that are experts that can help them with this reporting. I do also want to do a little aside here. When I'm talking about experts, I'm talking about both experts through experience and experts through training. And I want to recognize too that there's an overlap between those domains. When you do your media work, you might, if you're an expert through training, so someone that has an advanced degree related to drug use or addiction, if you're an expert through experience, you have lived experience with drug use or addiction. Again, you might not talk about both of those things in those interviews. You might want to try to put forward, this is my academic profile, this is how I want to talk about it. Or you might want to put forward that personal experience that you have. And those are individual decisions. We can always talk. We do talk with a lot of experts about that, like when to wear which hat. Because I will say, when we've done these trainings in the past, one of the things folks have gotten frustrated with before with the media is like maybe they have disclosed that they are in long-term recovery themselves. And then all of a sudden, like that's a big focus of the article instead of the thing that they were talking to them about. So, helping kind of think through strategically how to approach that. But we want to recognize that like both of these groups have expertise that are valuable for the media. We really advocate for the media to talk to both of these groups and try to platform both experts through experience and experts through training. But again, want to recognize that there is overlap in that Venn diagram. Okay, so before you start working with the media, it's really important. I think if you're on this call, you're like at least tangentially interested in doing this. But it's really worth understanding and trying to evaluate like what is your motivation for doing this work. For us and for me, why I take the time to do this is because, I want to make sure the media understands this topic because I've already dedicated, over a decade at this point of my life to helping advance these issues in a research capacity, helping patients, helping harm reduction workers, offering whatever services I can to like help reduce the harms of this crisis that we're experiencing. So one motivation could be, hey, I'm already doing all this stuff. Like it'd be really great if the news media also talked about it in the same way that we all talk about it in those other spaces. I also want to emphasize that, at least from our perspective, we think it's our responsibility to be a source of knowledge and science for our community. Because if we're not going to do it, where are they going to turn for those stories? If we're frustrated about the news coverage about this topic, and it is understandable to be frustrated, part of the reason why it's so challenging to cover these stories is they don't have access to experts like yourself who can walk them through those issues. So we can't really complain about the problem if we're not going to get off the sidelines and help out folks trying to solve the problem. And then, of course, just being a good citizen. I know, especially in university roles, there's going to be a comms department that's oftentimes involved if you are representing the university or in your official capacity in the university, if you're at a hospital setting. And we totally understand that. But even talking in your personal capacity and just being a citizen, whether it's a local news or whatever, and just saying like, yeah, hey, I can help you out with this. This is an important thing to know. I know about it. Let's talk. So because sometimes it does take a long time, we recognize, to get like clearance and all of that sort of stuff. But we still think at the end of the day, being a source is a really vital part of our role as citizens in our country and in your community. So how do we help you? I will talk about like what the help is, but we offer technical assistance. We're going to go through each of these specific things today, but we have toolkits. We do trainings, which is a little bit more involved than what we're doing today. And then we also help out with op-eds. Op-eds are a really great way to get those expert voices into those discussions, especially if there are topics that you want to weigh in on. So maybe you see coverage and you're like, oh, God, again, they're doing this, whatever. Writing an op-ed can be a great way to get the other side out there, but also like the news pays attention to that. So like if, for example, with the rainbow fentanyl stuff from a couple of years ago, when experts were writing op-eds that were saying like, hey, this is really like not a thing that people are going to put fentanyl in candy and hand it out. That did help kind of draw that attention to there is this other side of the issue. There are other people that are talking about it, and help kind of turn the tide on that. So we help out across all of these things. We have tools for all of them. But if you're writing op-eds and you need help, feel free to reach out and we can help you out with that. Some additional resources that we offer for both experts and for journalists. We have an ethical language style guideline that's based on the AP style book. So that is, quote unquote, the Bible for the journalists. So all of our resources are like developed based on that as a foundation, but also the academic research that has come out since 2017 that informs things about stigma and discrimination. We also have some resources about visuals that can be really helpful for journalists if you're seeing like harmful pictures. But we've also heard that it can be helpful for experts as you're doing talks or doing work in the community. We don't want to use images that are harmful for folks. And oftentimes experts are like, I want to put some images in the talk instead of just like QR codes like I have. So like, what are some ways that I can do that don't cause harm? Excuse me. We have a specific resource hub for opioid settlements, which we'll talk about here in a little bit. That's a big focus area for us because it's a great news hook. So one of the ways to get people interested in reporting on addiction ethically, instead of going to them and being like, hey, you're not doing a great job of this, it's saying, hey, there's this really big story in your community, like opioid settlement money, because in Nebraska, they're getting hundreds of millions of dollars over the next 18 years. Are you interested in covering that? If so, like, let's talk. And then you kind of work in some of those ethical considerations, those stigma stuff, et cetera. The op-ed writing toolkit. We also have a privacy toolkit and a trauma-informed interviewing toolkit. So the trauma-informed interviewing toolkit is great if you work with harm reduction or impacted community members or those experts through experience, or you're an expert through experience yourself, helping like kind of think through some of the considerations when working with the news media. And then obviously it's kind of dual purpose. It also helps journalists approach those interviews in a way that's more empathetic and trauma informed, so it doesn't like reintroduce trauma for the individuals that are experiencing trauma already associated with drug use and addiction. And then we are having a new contingency management primer that's coming out like super soon. Like it's supposed to be this week, but I think it's going to be early next week. So we're excited about that. We're always trying to come up with new resources. If anybody on the call wants to either help with developing resources or sees an area that they would love to see a resource developed in, feel free to reach out. We're always open to that. Okay. That was a really long throat clearing background about reporting on addiction, but I do think that helps set the stage a little bit. Now we're going to get into some more of the meat of it. And again, feel free to ask questions during this or throughout. So when we do talks about reporting on addiction with journalists and with experts, it's important to say, like, what are we talking about when we're talking about addiction? We use the ASAM definition, or the American Society of Addiction Medicine. It's the idea that addiction is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. People with addiction use substances or engage in behaviors that become compulsive and often continue despite the harmful consequences. And then prevention efforts and treatment approaches for addiction are generally as successful as those for other chronic diseases. Now you'll notice here on the slide, there's a bunch of different colors. When we do those more in-depth trainings with journalists, we really break down each of these specific parts of the definition. We've worked with the folks at ASAM that helped develop the definition. If you were part of that group or just like really interested and like a sicko like me, just like love talking about addiction stuff and helping people understand it, you know that like each word was really, really like painfully thought through and chosen. And so we go through in great detail to help them understand like why these words are the words that we're using, why this framing can be really helpful, and why as a reporter, if you approach a story about addiction with this definition in mind, I guarantee you, and we've already seen it, you're going to start in a whole different place than a lot of the coverage that we're seeing today. So again, it helps to just ground the conversation in this. But why this is also important is when we think about that definition, the idea of addiction stigma, which is that pervasive belief that addiction is a personal choice reflecting a lack of willpower and a moral failing, that is diametrically opposed to that ASAM definition. So you can help them see that, like, hey, like when we're talking about stigma, when we're talking about discrimination, why we're talking about that is when we think about it in this chronic disease framework, when we think about the brain, when we think about genetics, when we think about previous life experience, you can see how that's not just this personal choice or this willpower or failing. Like it's just a lot more complicated from that. And that already really opens up their brain to thinking about this topic very differently. Do want to touch a little bit on, there's a bunch of different types of stigma. If you're a stigma researcher, you know this. If you're not, that's okay too. But the main one that we try to talk about when we talk about working with the media is addressing public stigma. So public stigma is that stuff that's the belief that people who use drugs, they're dangerous, they're immoral, they're criminal, all those things. And what that leads to when that's perpetuated by the media, which it often is that direct discrimination, right? So it's that idea that then as an employer, like, why would I want to hire someone that's a criminal? If I'm a landlord, why would I want to rent to someone who's a criminal or who uses drugs because they're a bad person? So you can see how that like creates that cycle between those beliefs and those actions that are really harmful. And again, like we're not under the impression that like journalists are trying to do this, of course. And oftentimes when we work with journalists, it's always very impressive that they like, once they start to hear these different definitions, they're like, holy shit, like I've never heard of that before. I've never thought that way before. I wasn't familiar about that. That totally makes sense. I can now see how that could be harmful. But of course, if you're on this call and you're either a provider, researcher, or person with lived experience, you also know that these harms are very real. We talk with a lot of groups with those experts through experience too to help them navigate working within media, and they'll share their experiences. Like I did a an interview with local news, and all of a sudden I came home and like my stuff was out of my apartment because like the landlord was like, I had no idea you were a drug addict. I can't believe that I was renting to you, whatever. And of course, that discrimination isn't what the story was trying to hit on, right? They were trying to show this feel good story about this advocate who's working in this space, but those real implications were felt like immediately by that person, right? And as much as that's illegal to discriminate in that way, the downstream consequences of that, like they now have to find a lawyer, they now don't have somewhere to live in the meantime, they got to move, like all of those things, those were immediate consequences that they faced. So we really want to make sure that like when we're thinking about stigma and discrimination, we really help them understand that this isn't some ephemeral hypothetical thing. This isn't like a word policing PC sort of, like these are things that have real world impacts on people in your community. And I guarantee you that like for the vast majority of journalists, that's not what they're interested in doing. So we can help move them towards this more accurate and empathic framework when we help them understand that. I also want to stress too, and I think again, this is probably intuitive to folks on the call, but when you're talking with journalists about this topic, it's really important to consider some of those intersectional elements. We know that how, for example, drug use is represented or opioid use is very different than the crack epidemic in the early or the late 90s, or, late 80s, early 90s, right? So we know that there's some differences based on race and how it's perceived. I do a lot of work also related to pregnancy and drug use. Pregnant people who use drugs and are in media are perceived super differently than just like a regular old 40-year-old dude that was like working at wherever now and they're like living their life in long-term recovery. Or if you think about alcohol versus methamphetamine. So we just want to make sure that when we're thinking about how we're improving coverage, we're also kind of keep in mind, we want to make sure that we elevate the voices of folks that have those different life experiences. And that we're also helping journalists be sensitive to the fact that like how they tell a story about a pregnant person who uses drugs might be perceived super differently than how they tell a different type of story or some other marginalized community. So just quick here, and again, this might be easy for folks. I promise I'll get to the part that is like the practical advice, but I think it helps us set this foundation for what is stigma. These are some good examples we like from national coverage that are associated with stigma and that can lead to discrimination. So I still remember it's a People magazine double spread. It was the cover that day. I saw it when I was in West Virginia for my PhD. It was in the clinic by chance because I like subscribed to People magazine. And the born addicted, obviously there's problems with that framing because babies can't be addicted to drugs. But the other thing that really comes through with this is like the image is very evocative. It is visceral. And when you hear born addicted and you see a baby crying and in distress, a lot of people are going to see that and be like, that mom and that family, they are pieces of shit. I cannot believe they did that to that kid. That is just like most of the responses that people are going to have. And the journalists, maybe they don't necessarily want that response to be that way. Maybe it's a great article about how there's so many barriers to treatment for pregnant folks, or that neonatal abstinence or neonatal opioid withdrawal syndrome is actually readily treatable with something like Eat, Sleep, Console, but most facilities don't offer that. Or any of those other things that we know are barriers for pregnant people or can be challenges with families and drug use and addiction. But that image just leaves you with like, oh my God, like this is a terrible person that did that to them. And also, and you may be already starting to hear this sort of stuff, and obviously like it isn't borne out in the data, but the idea that like that kid is screwed, like that kid was born addicted to drugs. I don't want that kid in my school. I don't want that kid, like I can't imagine my kids being friends with that kid. Teachers were terrified of this wave of opioid addicted kids that were going to come into their schools as kindergartners. And so like this just like framing is inaccurate, but it's super harmful, like way above and beyond that. I also want to call out the harm reduction one. This one's a little bit more subtle, but the idea of putting like harm reduction in quotes, there's actually another New York Times article today that referred to like the reduction in harm reduction services in big cities across the country because of some of the executive order stuff, Trump administration signaling about harm reduction. And so they put harm reduction in quotes again. Again, the idea of like harm reduction being in quotes is actually a way to kind of like diminish it as like a scientific approach, because it kind of sounds like harm reduction, quote unquote, is what they call it. But we know that there's evidence-based principles behind those harm reduction approaches. And we know there's a lot of workers that are trying to get that work out there. There's a lot of great work that's already being done in that space, including research. And when you do something, again, as subtle as quote unquote harm reduction, can you imagine them doing it for like quote unquote treatment or quote unquote vaccines? They would never do it for something like that. And so, again, those things really do have a pretty big impact in how people perceive the work that we're doing. So we want to make sure that other people and other journalists understand it in a way that's a lot better than that. So how do we reduce stigma? I've talked a lot about stigma, the problems with it. Again, those are those things that we're focused on in terms of reporting on addiction. We are doing stuff like emphasizing person-first language. So person with a substance use disorder, person with an addiction, person with an opioid addiction, whatever. Person-first visuals. So we have that guidance on that specifically. We talk about things like making sure there's consent, obviously. There's consent for a lot of images. There should also be consent, like just taking pictures of people that are overdosed isn't necessarily like a great way to advance our understanding of those issues. If it was, and I hate to break this to like every journalist that we ever talk to, then like for 20 years of pictures of people overdosing, we wouldn't still be in the issue that we are. Like we just need to think about visuals very, very differently. Including protecting privacy and anonymity, because it is a health condition that has that stigma and discrimination associated with it. Stuff like emphasizing solutions, and this is where you come in as experts. I know that the person-first language, a lot of people, that has become something that's intuitive and something that, like, as a field, we're doing a lot better with. But that emphasizing solutions when talking with journalists, and when I say solutions, I put that in quotes because I know that's not oftentimes how we think about it as researchers or providers. These are different approaches. These are evidence-based practices, any of those things. In the journalism world, there's a framework called solutions journalism. And the idea there is that you talk about what things are happening in your community, and then you try to talk about what solutions, quote unquote, are happening in a different community. So there's already like the idea of solutions that is a thing that journalists are trained on. Again, I don't really love the word solutions because it sounds like kind of silver bullety, but emphasizing those solutions to journalists, like what are things that work? What is medications? It's behavioral treatments. Like I said, we're doing that contingency management one. We do harm reduction resources. We talk about evidence-based prevention. Like those are solutions that can move us away from the problem that we've been experiencing. Empathetic narratives that humanize people and then emphasize that societal instead of individual courses of addiction can be really powerful too. There's been some research on that if you tell a story that's like, X person used drugs, then they got treatment, and then they moved on. That's perceived very differently than like they experienced these issues growing up, or they experienced these issues surrounding the event, or they got to college and they were very disconnected from their social environment. They started experimenting with drugs, XYZ, it rolled into these other things. That can help people have a broader understanding that it wasn't like, well, this person just like used drugs and got addicted. Well, ding dong, like don't use drugs, right? That's how you kind of get there, is when you tell those simple narratives. If we tell more complicated, more humanizing narratives, it helps like buffer some of that perception. Okay, so I love this part with experts. This is what we call Journalism 101, and this is just a little bit about how journalism happens, how it works, and then how you can intersect with journalism. A little bit about journalists, and this might sound intuitive, but journalists are humans. And so as humans, they make mistakes. And when they make mistakes, it's understandable that we as professionals can see that and be like, what? I cannot believe they did that again, or I can't believe they keep doing that. I talked to them already, or they've talked to whoever, right? All of those things are like understandable frustrations. But at the end of the day, like they are humans, they make mistakes, they have biases, they have fears, and they also have a ton of professional pressure. The news environment right now is brutal. It's been brutal for about 10 years. There's a lot of layoffs happening all the time. There's a lot of pressure for more content. And the idea that like they just have a bunch of time to do a thing, most journalists don't. There are some journalists that we work with and talk to that it's super cool. And they say like, it is a luxury. Like I'm going to have 4 months to do this story. And I'm going to travel. I'm going to do this. I'm going to do that. It's going to be awesome. I'm going to talk to like 10 people. And then there's other people that are like, I have a deadline at 4 o'clock. Can somebody please help me? I'm trying to understand this issue. So you can understand then like why they might have issues related to making mistakes with their coverage because there's a ton of pressure on them. We also all have biases, right? And the idea that like journalists wouldn't have biases about a topic is just foolhardy. What we try to do when we work with journalists is help them understand their biases and how that shapes their coverage. And by raising that, like, this might be a bias that you have against, for example, medications, or that you have against harm reduction because you really believe that abstinence is the only way going forward. And so we can talk through that and they can see how that's coming through in their article. They don't want to have bias come through in their article. So talking about it in that way, that's a respectful way, can like kind of help them through it. And then they also, like I said, have deadlines and bosses. And some of those deadlines are like super tight. Like literally, I've had a number of journalists over the 5 years that are like, I need something today. We have a hard time as professionals, like working on those same timeframes. And I totally get that. But we'll talk about a little bit how, like, hopefully you can help out in those cases still as well. So it helps to understand a little bit about like the types of stories too. So there are those like daily coverage ones I talked about. Those usually have those shorter deadlines. The investigative ones usually have a little bit of a longer lead because there's a lot of research that needs to go into it. There can be feature ones that also maybe have a little bit longer lead, maybe have more art, that sort of stuff. And then opinion pieces, opinion and op-eds and commentary are a separate part of the newsroom typically. Excuse me. So, if you're working with a journalist and they're doing a great job covering it, and then you see an op-ed or something that like says something totally different, maybe the editorial board comes out with something, just understand that like those usually function pretty independently. And then when we think about the different ways to conduct an interview, you can either be background. So background is the type of thing where like you'll be suggested by in the source. Like they won't say like a University of Nebraska researcher, but they'll be like, I talked to 3 experts on the topic, and here's basically what they said. You can also be off the record, which they won't like allude to you if you're off the record. So saying like being very clear when you're doing the interview or during the interview, saying like, hey, I'm off the record. I don't want to be cited in this. And then they'll say, yep, you're off the record. That's okay. It has to be like an agreement. And try not to, this is also a thing that we've learned in the 5 years of working with experts, try not to like jump back and forth because that can be a little bit confusing, or like you can understand why a journalist, especially on a short deadline, will be like, wait, was this part off the record or was that part? Like what part? So try to be like, I'm going to talk to you on the record with this part, and here's what my public quotes are, but I'm also hearing these things that I want to talk to you about off the record, but I don't want tied to me. And then of course, on the record where your name and or image is going to be associated with it. If you want to be off the record or background and like be an anonymous source, maybe you have a tip. I would suggest using secure communications, and we have that resource for how to do things in a private and secure way. Most journalists use those tools like Signal. Some also have like depositories where you can just like dump information into this like basically secure portal for them. So if, for example, you're on the opioid settlement committee for Lincoln and there's just some like wild stuff that's happening, you might want to talk to the journalist about it so that they can cover it, but you don't want to like compromise your role on the committee. And so, you want to talk to them on background. Okay, again, like if there's any questions, no, I see a thank you. Okay, I don't see any questions, but if there are any questions, feel free to drop them in. So one of the things that we want folks to keep in mind when you're talking to a journalist about drug use or addiction, oftentimes we think like, well, that would be a health or science reporter because I'm a health person and addiction is a health condition. But the reality is like addiction hits across the different beats in the newsroom. It can be the crime beat, and it's frequently covered in the crime beat, but it can also be stuff like sports. It can be like technology sections. It can be politics, whether it was like the Pete Hegseth confirmation or Hunter Biden, any of that. So like it can hit across beats, and all of their foundations in drug use and addiction and the science behind it is going to vary drastically based on where their coverage beat is and their resources. Our goal at reporting on addiction is if you're in entertainment and you're covering Wendy Williams or you're covering Matthew Perry, I still want you to cover it the same way that a health or science reporter would talk about addiction, because it is still a health condition. And so if I'm reading a story about Matthew Perry's overdose, and I don't understand about treatment or how to find treatment or access to recovery services, then you've done your audience a disservice. And so just important to keep in mind that like the person that you're talking to is going to come at it from a very different perspective. Our goal is to help them get that science and medicine sort of framework. And when you're talking to whether it is like, a crime reporter, emphasizing, hey, this is a health issue, and this is how we talk about it in this community. The other thing that we like to try to help journalists understand, but that I would point out for folks like yourself on the call that are interested in working with the media, is we really want to broaden their scope of understanding about addiction to include stuff like evidence-based prevention, harm reduction, treatment, and recovery. A lot of the focus is on, for example, like active addiction, maybe it's overdoses, maybe like the overdose crisis that we're experiencing with opioids. Maybe it's alcohol on tribal communities, which I know continues to be an issue in the Great Plains area. Maybe it's methamphetamine, whatever that is. Maybe that specific story isn't going to talk about treatment or recovery. Maybe they're just talking about active addiction. Working those talking points in that, like, hey, here's how we treat that condition, can help them understand that like it's more than just like the thing that you're talking about. Addiction is actually a pretty broad range. And you as a reporter might have some really cool stories going forward about, for example, evidence-based treatment. One of the things we know with journalists is they're always looking for new stories. So when you broaden their lens, they can be like, oh, I hadn't really thought about what are our schools doing related to prevention? Because like this is a thing that they should be talking about. How do they do they use evidence-based approaches? Is opioid settlement money going towards evidence-based approaches? And you can already like start to see the wheels spinning for them. So helping use, we think this framework can be really helpful to like, again, broaden their perspective and encourage you to use it when talking to journalists. Okay, so some practical tips for how to work with the media. All right, so the journalist reached out to you, and for a lot of folks that can be really stressful, and I totally get it. I, at this point, have done it a ton. I do a lot of conversations on background because it's not like reporting addiction isn't like a vehicle for me to be in the news all the time. I really like don't want that. So, we talk, we do whatever, and, I just really want to emphasize, like, I totally get it. If like someone reached out to you, you're like, oh my God, what the hell do I do? So one thing you can do is like reach out to us and we can help you out. You can reach out to your comms department. They can help you out. And no shade on the comms departments for universities or hospital systems, but sometimes they can be a little bit slow, especially with the journalist that's like, I need something tomorrow. So navigating that can be tough. And like we try to fill in those gaps a little bit. But the biggest thing you can do is respond promptly. So if you want to decline, totally cool. Maybe you're lacking the time, maybe you're lacking the desire or the expertise, and it's just like not the thing that you're interested in. Maybe they want to talk about meth. And like for me, I'm more of an opioid person. With reporting addiction, I talk to them on background. I'm like, hey, here are some people you can talk to about methamphetamine. Here's what we know about treatment. Here's what we know a little bit about it long term, et cetera. But I'm like, I'm not a methamphetamine expert in any sense. Here are the people that you should talk to. So declining and helping connect them with a colleague is huge. Consider some junior faculty members. Maybe there are some on this call. Maybe there are some that have talked to you before. They're like, I'd like to do more dissemination. I'd like to talk more about this. Or they say like, hey, I'm frustrated with how things are going with whatever. And you're like, hey, maybe taking some time to talk to a journalist would help you kind of think through different ways of presenting your information. Of course, connecting with scientists from underrepresented groups can be really powerful as well, and making sure that we have diverse sources in the media is really, really important. A brief aside, there was a national publication, which I won't name here because like I don't want them to, we try not to shame folks, but they were talking to us and they're like, hey, we're interested in some news stories. Seems like you always have stories, ideas. What do you want to do? I was like, a story that I don't see a lot talked about in the national news is what recovery looks like in Black communities. And you're like, holy shit. I also haven't really thought about that perspective. I haven't done that. I guess I haven't at our outlet. Like, wow, that's really interesting. They spent a few months because it was a national outlet. They hired a photographer from the community. They took some beautiful art and had a wonderful story. And it was one of those ones that, like, again, like random people sent it to me. They didn't know that I like seeded the story. Well, I'm not interested in any of that. But the idea that like, they were just like, oh my, I just had never considered how this looks in across these other populations or across these other things, whatever. Like that can be an awesome way to like get those stories out there that you're not seeing, and connecting with underrepresented scientists can be a good way to like say, hey, there are providers in this space, there are harm reduction workers in this space that are doing this awesome work. here's who they are. And then, of course, a colleague who just wants more media opportunities. I know, again, like nobody's looking for a bunch of stuff to do, but there might be people who are saying, hey, like I really want to do more to work with the media. They tend to talk to me from across the country. But like if you're one of those people, signing up for the database is a thing that you can do. But of course, just like sending me an email and just being like, hey, if you hear things in Nebraska, like hook me up. I'll do anything that you need when it comes to talking with the media. I am very passionate about this. I love having those folks on board. It's super important to like advancing understanding of this issue. The other thing you can do when you decline is ask who they plan to speak to. So connecting them with good people, but like sometimes they'll be like, oh, I'm going to talk to Sally. And you're like, ah, oh, shit. If they're going to talk to Sally, like I should probably have time to talk to them because I know Sally is just super into detox, abstinence only things. And I want the journalist to understand that there's medications or these other approaches. And then in some cases, like detox can be XYZ. So that can help. And then, of course, offering to help in the future is always super nice and just saying like, thank you for reaching out. Sorry, I can't help you at this time, whatever. Because, that can be really beneficial for them. The other thing, and this is like super rare, it's usually if there's like some sort of expose. But like if, for example, and I doubt that any of you are doing this, but like there's some huge scandal with like your grant in your lab, or maybe it was one of the grants that was canceled at the beginning of the year, a journalist might reach out and be like, hey, I saw your grant was canceled. Can you talk about it? And you're like, no, I can't talk about it. They might still say like, hey, I tried to reach out to University of Nebraska and they didn't receive comment. Again, that's like kind of a different thing than most of what we're talking about, but just keep that in mind. If it is something related to what you think would be perceived as like a controversial reason for saying no, or that it could be perceived as you're running away from it, talking with folks, talking with us, talking with comms people can help you like navigate that. But, let's say you're interested. That's super cool. That's what we're all about. One of the next things you should do is triage. We're all busy. But really consider who is the audience that you want to reach. If you're going to take the time to talk with the journalist, make sure it's productive and going where you want it to. A lot of us really try to think, oh, the most important things for me, because I'm this big fancy person, it's the New York Times or the Washington Post, LA, whatever. It's those big ones. Anyone else, I don't have the time of day. I'm too busy and fancy and whatever. And that's totally fine. That's a perspective. And it's an understandable perspective. Some people that like make sense. But like local news can be super important for helping local folks understand local issues. Policymakers in your community, decision makers, people on opioid settlement committees, any of those folks, your lawmakers, they're going to cite the local news, the Wichita outlets, the Lincoln outlets, way more than they're going to be like, I saw this thing on ABC News. So if you want to have an impact in your local community, local news is a great way to do it. It's also highly trusted. You might know, but there's a lot of negative perceptions around national news right now. But local news still has a lot of trust and buy-in from folks. So, thinking through that and really weighing that when you're doing triage. That's not saying that every local news article that you hear about, you gotta jump at, but I just really want you to like reconsider if you do have a stance that like, I don't think that's worth my time. I promise you it is. And then the other thing to kind of consider is there is a lot of specialty news outlets that is going to like target those specific populations like Politico, Wired, whatever. It's a little bit more niche, but if you have a thing that you're trying to hit that specific group of folks, go for it. The other things you want to consider are, for example, do you want to talk to student journalists? On our database, when you sign up as an expert, you can choose whether or not you want to work with student journalists. I can tell you student journalists are always looking for sources. They're also looking for ways to practice interviewing, and it can be a great way for you to cut your teeth interviewing if you don't have a lot of experience, or if you're nervous about it or anxious about it. Or again, if you just want the students on your campus to understand, hey, there's a new recovery center, or here's what treatment looks like on University of Lincoln's campus or the other campuses that University of Nebraska has. Student journalists are the ones that are going to be covering those stories. Maybe it's stuff about like alcohol use with football games and tailgating. A student journalist is going to cover that. A local news one would too, but like, it'd have to be pretty bad for it to reach a national outlet. But you can have a real impact on a student journalist covering a story about, are there spaces where people can like sober tailgates, those sorts of things? Are those sorts of environments curated for these sporting events that we know are such a big deal at University of Nebraska? Go Huskers! Or are we like kind of missing those stories because we're not talking to student journalists? And of course, like the university press office can help you weigh options and assist with interview logistics, and are great partners in this work. Talking points. Again, this is something I always am improving. And it is hard because when we think about addiction and we think about news coverage, there's just like so many things that we want to talk about. There's so many things that we want to help the journalist understand. They might ask a really simple question and be like, oh, overdoses are a problem in Omaha today. Or like the overdose numbers came out. Can you talk about that? And you're like, yeah, of course I can talk about that. Here's like the 7,000 things you need to know that we could be doing better. The reality is we want to have those talking points. We want to spend time beforehand prepping those talking points and really making sure that like we stick to those talking points. I know that can be like a little bit annoying and it can be hard. And again, like I struggle with it. But like making sure you boil it down to those three things, making sure those three things are really what the journalist is talking about and they're concise and clear is going to really help both ensure that the journalist understands it, but also that like your quotes are in the story. If the journalist leaves it and they're like, I have no idea what the hell that guy was talking about, then obviously it's not going to end up in the story, right? So taking the time to write these things down and you can have them on hand as you're doing the interviews. And I did also, sorry, I should have said this before. A lot of this is based on like journalists pursuing stories. There might also be stories that are about like your specific academic research. Maybe there is a news press release or something. You have a new article and it started to get picked up. These same points really apply there. But I also want to emphasize that sometimes a journalist is going to find you because you're at the University of Nebraska and it says something about addiction on your profile. And they might not care at all about any of the 50, 500, 7,000, or 7 research articles you wrote. They just need someone that like understands something about whatever it is with addiction that they're asking a question. So just a caveat, like they don't always want to talk about your research. I know experts get like really frustrated with that, but we can still do a lot of good helping them understand like the broader concepts, which they don't normally have support with. So what makes a good quote? A good quote is at a child or 5th grade level. And that's not patronizing. That is how journalists are taught to write, is at a 5th grade level. We don't often talk at a 5th grade level. If we are instructors, we often don't instruct at a 5th grade level because we are instructing in college courses. When we write our academic articles, they are far from a 5th grade level. But if you really, really want to help and you want to help them actually understand the concept, then like taking the time, writing down those talking points, thinking about those talking points, and making sure it is at an understandable 5th grade level can be really, really helpful. The other way that I think of it, and this is not to diminish my grandma, who I love greatly, is I think about like, how do I talk about this with my grandma? How do I talk about this with my parents? I talk about it very differently than how I talk about it at conferences or how I talk about it with folks in the community when I'm riding the bus somewhere and they're like, what do you do? I talk about what I do. I don't talk about antagonists and agonists. I talk about there's medications that are available and sometimes they're really hard to get, but they work really well when people can get them. And we want to make sure that they're more available in our community. That's a 5th grade level. So making sure that we're leaning in on that, we're bringing that expertise. The other thing to keep in mind there is that sometimes journalists, when they will ask you questions for those quotes, they're going to ask you a question that you're like, this is super basic. Why the hell don't they know that there's medications? Sometimes they just need you, the expert, to say medications do this, or there are medications that are available for this, or evidence-based prevention does this, or harm reduction is this. Because they don't want to, like, they can write it in the article, but it's way better if it comes from expert from University of Nebraska-Lincoln said this about treatment, right? So again, the story or the question can sound really basic, but that doesn't necessarily mean that they don't understand the topic at all. Sometimes they don't, and that can be frustrating, but like, that's why we're there. That's why we're helping. So recognizing, again, boiling it down to a really simple thing and recognizing like they want a quote from you. So if you think about when boiling down those talking points, what is the thing that's going to end up in the article? What is the quote? What is the takeaway? The other way to kind of think about science communication, like I said, is we want to think about this in a very broad audience term, which means very, very reduced complexity. A lot of the writing that we do is going to be at the bottom of that complexity pyramid where it's incredibly complex. But that has a very narrow audience. So when we take the time to talk to folks that are hitting those other audiences, we need to make sure that we're doing it in a way that actually helps them out. Okay. The other big takeaway here is that you don't know everything, and it's okay to not know everything. Journalists will respect you a ton if you say, that's a great question. That's not really my thing. Let me try to find someone who can help you out with that. You can also say something like, I'm not prepared to talk about that right now. Or maybe they're asking for a number, and there's plenty of times where I'm in an interview and I'm talking. I'm like, you know what? I can't remember what that exact number was right now. Can I follow up with you in an email? I'm going to find it after this conversation. I'm going to find that email just to make sure it's accurate for your thing. They'll appreciate that. Do not pull stuff out of your ass. Do not make stuff up. That is something that is going to kill your credibility immediately. But if you draw those clear boundaries, that's going to give them a lot of respect for you and also save you a lot of hassle of trying to do all the things all at once, which is not really what we're trained to do. So some quick do's and don'ts. Using analogies can be really helpful. Using anecdotes can be really helpful because they're going to want to tell those stories. But consider that you're also trying to help them understand the topic. So an analogy is a great way to help them understand it. Like my example with stigma, that is an anecdote that I've heard. I've heard other anecdotes like that. That anecdote really resonates with journalists when we talk about stigma and discrimination. And a lot of them are like, shit, I had never considered the fact that somebody could lose their job if they talk to me as a journalist and disclose that they use drugs. Just never crossed my mind. So that analogy can be really powerful. There's other types of analogies that are like that. Maybe you work in a clinic and you do buprenorphine and you're like, there's only a couple pharmacies in our area that stock it. Most of the people that come in for treatment, they have to travel an hour or so just to get their treatment or to get their medication filled. You better believe a journalist is going to be like, wow, that doesn't sound right. I want to ask more questions about this. You can always ask for clarifying questions. I'll give a quick anecdote because I want to do that. I was talking to a journalist and we were talking about opioids. And they asked a question about meth. And I was like, hey, just to clarify for a second, are you talking about methamphetamine or are you talking about methadone? They're like, both. It's like, well, they're pretty different. So which one, what really makes it, I said it nice to that, but which one are we talking about? And she's like, they said, I actually didn't know that they were different. I said, okay, so now let's drill down a little bit more and talk about the differences. When we're talking about opioids, let's talk about methadone. We can talk about methamphetamine later, but when I'm talking about treatment, I'm going to talk about methadone, right? So asking that clarifying question, again, it seems really silly, but I have dozens of stories like that where they're just like, oh, I thought we were talking about meth. And it's like, no, this is something different. So helping clarify, never assuming that you're on the same page. Asking for a summary at the end of the interview can be helpful. Hey, can you tell me, just to make sure you understand, can you read it back to me or give me your understanding of it? Journalists aren't offended by that. That can be a way for them to also ask more questions for clarification. And then really try not to use acronyms, abbreviations, or jargon. Like I said with the meth example, that led to that misunderstanding is they were talking about meth. I was talking about methadone. They didn't connect that those weren't the same thing because there was an acronym that they were using. So I always try not to use acronyms. And when somebody uses an acronym, I ask for clarification. Okay, after the interview, quick, you can offer to review the article, especially if it was on a complicated topic, but do not require to read it. This is something we really try to stress with experts. A lot of experts want to read the articles. They want approval of it or whatever. Journalists have ethical codes that they do not send those articles for approval beforehand. Some journalists that I've worked with will send me my quotes and say, hey, can you double check that the quotes were correct? Sometimes they send quotes and a little bit of context, and sometimes they don't send anything. That's all totally fine. But if you think about it, this makes sense because can you imagine a context where every time they did an interview with the mayor, before they wrote the story, they sent it to the mayor's office for approval? Of course they wouldn't do that. So even though it comes from a good place or it comes from a place of being concerned about being misquoted, you can offer to review it, but do not require it. That's going to burn a bridge really quick. You can always follow up with your 3 points. You had them written down beforehand. Just say, hey, just to reemphasize, these are the 3 things that I think are really important. And then thank them. That's always just good for building that relationship because the idea here is not that you're a one-off source, but you're someone that they can work with in the future. So quick here, some things that you can do today. You can write some op-eds. We have some resources around op-eds. The biggest thing there is finding news hooks. So what are things that are being talked about in the news? Harm reduction is a really buzzy thing. Maybe you do research or advocacy or provide harm reduction services. Awesome. Write an op-ed for your local newspaper about why harm reduction is important. How to write op-eds, we have a toolkit for walking you through that have those best practices. We also do support folks that are doing that. So we can help with the pitching, the writing, any of that. If you need support, just like reach out and we'll try to figure it out. We're always really excited when experts want to use that tool to like disseminate this information, and it can be, again, really powerful. The other thing you can do today is like pitch stuff. So if there are national stories that you know are going to catch on locally, pitch those stories to your newsroom, like the harm reduction one. Like you know that that's something that's already trickling down locally. Rainbow fentanyl a few years ago, like that was a big national story that we saw a lot of local coverage coming after it. If you're seeing that sort of thing that like, oh, that really caught attention nationally, I bet my local journalist is going to cover it. You can get ahead of it and email them and be like, hey, you probably have heard about this. Let's talk. Big picture takeaways, stigma remains a problem in the media. And I didn't say this before, but I should have. It's not only a problem in journalists. I know that we all know that there's stigma across different domains, including in professional settings, including in hospital settings. Our focus is just working on journalists because we know that they can help shape that in other spaces, but this is by no means only a problem in those spaces. And I don't want it to reflect that way. Like there's a lot of work we can all do with stigma, myself included, to make sure that we're not doing stigmatizing or discriminating things. We all want to make sure that we're working to reduce stigma in those ways. We want to call journalists in instead of call them out and build those collaborations so we become a trusted source. We want to help them talk about solutions. So if they're talking to you and they reach out, they're like, hey, there's this problem with a thing in our community. Let's say it's alcohol use. You're like, yep, that's totally a problem. Did you know there's all these things that we could be doing to help solve it that we're not doing? And then, of course, helping that journalist leave the story with the understanding that recovery is a thing that's possible and that there should be help available in our community, whether it's findtreatment.gov or any of those things. Those messages of hope and connection can be really important. So thank you. I guess I can keep that up. QR code just takes you to reportingonaddiction.org where we have all of these resources. My email's on there, but there's a contact link that gets to me or some of the members on our team. Again, really appreciate this opportunity. If there's other opportunities to do deeper training, technical assistance, or support, feel free to reach out. That's what we're here for, and would love to see if there's any questions. And I don't see any, so.
Thanks so much, Jonathan. We do have one question in the Q&A for you. They're basically looking to say if the journalist request is somewhat vague, how do you prepare talking points if you really don't know what you're walking into? Like if they just say something big.
That's a great question. Sometimes I'll follow up and be like, hey, is there a specific part of this that you'd like me to address in my role? So I might say like, I'm someone that focuses on evidence-based prevention research. So those are the things that I can talk to about this topic. Is that what you're interested in? If you need something about treatment, harm reduction, recovery, I can find someone else for you. So you can always ask for clarifying things. But also sometimes they might just have a really broad story. And so just having really broad talking points is totally fine. Like you maybe just want them to understand that like addiction's a chronic disease and that we should have long-term supports in the community and medication should be more available. Those are 3 great talking points that like, they're pretty anodyne, but they'll hit on any article.
Yeah.
I hope that answers the question. Oh, I see another one.
Someone asked if the recording is going to be shared. I believe so. Alexis or Devin, if you can confirm. I think we usually put everything up on YouTube. And then we've got a new one there.
Yeah, I see that one. Yep. So the advice around outlets that can be a little bit more antagonistic, this is a tricky one. So sometimes it's still about building that relationship, but it is totally up to you. So if you're going to think about like, how do I use my time to best influence public understanding of this issue? Making sure that you're using that well and effectively and not with people that like are biased or have an axe to grind is totally fine. But I will say, and we probably have seen this in an anonymous attendee, in your training or other work that you've done, that there are some people that have this really strong understanding about addiction, but after working with them for a time period, it can be something that changes. So don't assume that they can't open their mind up to understanding this. Most of the time, it's a lack of understanding about the topic. So if we kind of keep that in mind, we really think about this like a trainee, that can help like us be more open to those conversations. But of course, you don't want to put yourself at risk either. And so that's why having those strong talking points that are really concise, that can't be taken out of context, can be really helpful. And I see
Yeah, fantastic.
Oh, the recording,
While we're
yes.
waiting, I've got one if you don't mind.
Sure. Yeah.
So like I've done some media interviews over time. I'm still learning to get better at it. This has been great to go through. One thing I'm never really sure to handle though is you do an interview, the piece comes out, and you feel like they didn't handle your content particularly well. Or not necessarily like misrepresented or skewed it, but like that this was not what I was hoping to get out of this. Or how do you handle like that feedback back to the reporter or the news thing if you've interviewed with them and you're like, this was not good?
Yeah. No, Patrick, that's really hard. And it is something that we hear about a lot. And I'm not saying that this was in your case, but the broad advice that we give, the code for this, sorry. The broad advice that we give is to make sure that if we have those talking points and we nailed them, and we know that we stuck to those talking points, and then those talking points were misrepresented, then like that's a different set of issues. But sometimes, and I've had this happen, it's a 15-minute interview that becomes an hour-long interview, and it just like kind of went off the rails in all these different ways. And then they picked a part of it that I was like, I wasn't quite expecting you to like have that be the thing, but okay. So recognizing sometimes we can do things that like contribute to how the media misrepresents our work. If we really stick to those talking points, that like reduces that harm. And the example that I give is like a politician. I know we hate when politicians do this, but politicians are really good at saying the same freaking thing every single time because that is their talking point and they're sticking with it. So that's part one. Is like and I do this too, like just reflecting on maybe there's something that I could have done a little bit differently. But from the journalists like handling that outreach, a thing going forward is if they really butchered it or they did something that you find to be totally unethical or completely inaccurate, you don't have to work with them going forward. But thinking about it again as an ongoing collaboration, just saying like, hey, like appreciate the coverage in that last article. Do you have 15 minutes maybe to talk through a little bit? I noticed there are some things that were a little bit different than that I think were a little different than how we talked about them, or they came off a little bit differently than how I wanted. Maybe there are some things that we can talk about going forward, or there's some additional stories that you can cover that can expand the understanding of the topic.
Yeah.
So that's one way. If they use stuff like discriminatory or stigmatizing language, the other thing you can do, and journalists, experts do this a lot, is just say, don't take that bullet. Just say, hey, you should talk to these people about reporting on addiction. And then we become the bad guy that are like, hey, I noticed you had this story that had some stuff. Let's talk about it. So I'd say those three things, but sticking with it, again, recognizing this is a learning process and like journalists fail on the front page. Most of our failure happens in private. And like, I'm sure that I've written drafts of things that I've sent to my mentor and they're like, what the hell is this guy talking about? But it didn't get published, right? And so when a journalist has it published, like it can be embarrassing for us and it might be embarrassing for them, or they don't even know how they messed it up. So being kind and empathetic and just saying like, hey, this isn't exactly what I was hoping to come out of this, but I want to talk to you more. I want to make sure you understand this. I can tell you're committed to the issue and recognizing like you covered it. That's cool. Let's make sure the next time we cover it a little bit differently. Does that help, Patrick?
Yeah, absolutely. Appreciate it.
I don't
So I'm
have the
not seeing
code.
too many
Sorry,
others. I
anonymous
know we're
attendee.
just about at time, right?
I think so.
Yeah. So, Jonathan, I just want to say thanks so much for coming through, sharing all these fantastic resources. There's a lot here for folks to digest. Really appreciate it. Enjoy the talk a lot and look forward to learning more about reporting on addiction and all the resources you have to offer.
Awesome. Thanks, everyone, and have a good rest of the fall. Appreciate taking the time.
Thank you so much, Jonathan. Thank you, Patrick. Really appreciate it. I hope everyone has a great day. So good to see you all. Hope to see you at a future event. And I look forward to talking to you in the future, Jonathan. Thank you.
Kevin.
Thanks, everyone. Have a great day.